Can you imagine using leeches as a way to reduce blood clots? Well, that's exactly what they did in the 1200s. That was their medicine. Medicine has been used since ancient times, but has greatly developed through the centuries. Today, people have doctors, nurses, surgeons, therapists, and many other individuals in the health field. Society's definition of a healthy lifestyle and the way people live has greatly changed, and it has given most people a new perspective on society's health. Before medications and doctors, people often died and had no way to recover from illnesses and diseases because there were no cures. Advances in medicine are made every day now. These advances could be a new allergy medicine, a new vaccine to prevent a daily disease, or a new way of performing surgeries. But all of these advances have one thing in common. They can save lives. Eaton and Kennedy and Ethical Issues and Challenges explain how in the 14th century there was a plague that spread quickly called the Black Death or the bubonic plague. It killed 20 to 30 billion people in Europe in the 14th century. In China, it killed 12 million people in the 19th century and slowly traveled to America with the help of rats on ships from other countries. The bubonic plague was found in rodents like rats and also in fleas. If a person was bitten by an animal with the virus, then they would contract the bubonic plague. Thanks to better working conditions and antibiotics, there were only 2,118 cases of the bubonic plague in 2003 worldwide. Only 1 in 7 people die yearly now. Advances in medical technology over the course of centuries has developed to a great extent. Studies show that recent equipment has evolved more in the last 10 to 20 years than the past 1,000 years. Before human time, people learned to treat themselves by just using natural substances. Nowadays, our high-tech systems in the medical field have been created for the most effective tools for a high level of patient care. While they advance the tools, it will then allow for quicker diagnosis, less pain, and fewer costs, which in the end will help save more lives. Some people are accepting that modern technology that can buy them more time to live, while others might find it alarming because they fear loss of control. In places like hospitals, nursing homes, and households, patients and doctors are using this technology all the time. Unfortunately, not always is the equipment going to be successful to patient care. There could be a few cases where something could go wrong. In Edward Tenner's expert, Another Look Back and Look Forward, he explains what he refers to as revenge effects. These are unintentional negative consequences that sometimes occur when introducing new technology into practice. They are not thought about before an event occurs, but only after are these revenge effects can it overshadow the benefits that the advancements may have had. Complex devices that work together with our human systems always have negative effects. There, 3 of the most significant medical advances of the last 2 centuries are sanitation, vaccination, and antibiotics. Each of these advances have engendered enormous positive social and economic impacts in developed societies. Sanitation has successfully impeded pathogenic growth in human living spaces. Vaccines have protected humans from extraordinarily prolific diseases such as smallpox, and antibiotics have also saved countless human lives through daily sanitation and disease care. However, the impact of these 3 advances have not been fully realized because they have not yet reached substantial portions of the developing world. Vaccines for several prolific diseases continue to elude researchers, and misuse of antibiotics has led to resistant bacterial strains and other health hazards. The rudiments of urban sanitation systems have been developed several times throughout human history, but was nowhere near fully realized until the era of the Western industrialization in the 20th century. Once urbanization in the Bronze Age began to increase, population densities in urban centers, increases in waste production required the use of outflowing systems like rivers to properly dispose of waste. Moad, in his text, Innovation in Medical Technology, explains how the first documented system for sanitation was developed in the city of Mohenjo-Daro in 2600 BCE and consisted of slit cuts in the floors of houses to allow waste to drop into containers next to streets and bathhouses with cover channels that led to nearby rivers. Nowadays, of course, we have sewers, bathrooms, and many other devices that help with sanitation. As the years continue to pass, we will continue to grow in our medical advances and help people live longer. Thank you for your time. This was also my audience. And that's it for today.